I categorize telemedicine into almost, four categories here, but almost like two separate. One is based on mode of delivery. The other is based on kind of the mode of care, kind of. So you have, synchronous, asynchronous, or store and forward, and then you have, and then you have also, and on the other side, you have acute and you have disease specific. Acute care is basically, for those people who are not familiar with the terminology, it's considered to be almost like an urgent care type setting. Sore throat, pink eye, urinary tract infection, things that you'd go to your, you typically need to see a doctor about or need to see a healthcare provider for. But telemedicine works really well for like I said, things like pink eye, for sinus infections, things like that, where you don't need intensive care. You just need some level of care, and most of the time that can be dealt with via telemedicine. There's the acute care medicine has been around for a long time. Teladoc went public 10 years ago, more than 10 years ago, and they were around before then. Amwell's been around for several years ago, and that was kind of the model before the pandemic. Before the pandemic, there were also more entries into what's called disease-specific telemedicine, and I categorize this as, let's say, diabetes care, or let's say mental health care, or women's health care. These are kind of disease or condition specific uses of telemedicine. And they're meant for more like ongoing chronic care rather than specific episodic cares. And there's a lot of requirements to them. It has here in the States, we have what's called HIPAA. It's a privacy, set of privacy laws for patients enacted back in the 90s, I believe.